Shining the spotlight on mental health issues such as depression, we caught up with a group of counselors at Guam Behavioral Health and Wellness Center, including Terry Francisco, who says depression, just like any other disease, needs timely treatment.
Depression is just like any other medical condition, right? It's just like having diabetes or being diagnosed with hypertension or even cancer, right? Remove all of the stigma from mental health conditions. They're just like any other medical condition, right? And with early intervention, the person can have a better overall prognosis.
But unlike other medical conditions, many find it difficult to seek help.
A person experiencing a mental health condition, because of the stigma and the shame, right, in getting treatment, on average will take about 10 years to get treatment, right? And that's a problem in our community and in our society overall because, right, we're not getting people the help that they need as soon as they need it.
10 years too late. Andrea Atta, also an adult counselor, says there's a myth that you must hit rock bottom to seek medical treatment, when in reality, acknowledging signs early on can save a life.
Depression, it's beyond sadness. You're going to find a lot more physical symptoms. So you might be finding that you're having poor sleep or too much sleep. You're going to find that maybe you lack some motivation to do things that you typically would. You'd have a hard time concentrating. You're probably going to even experience appetite changes. There are numerous ways in which depression can really affect your ability to laugh, love, engage in your community.
Recognizing that every person is unique, Guam Behavioral Health has a variety of options for treatment, even extending their services to caretakers and joining the national movement to increase mental health screening. Sylvia Kanata says treatment starts with an assessment that now can be done in person or over the phone.
They're feeling down, they're feeling sad, maybe they're experiencing some kind of stress in their lives, could be a death in the family, or maybe relationship issues. So then that leads to these certain symptoms that we would look at, right, when people come in to see us because maybe they're feeling depressed. So we look at those symptoms and see where we go from there.
Francisco encourages all to call Guam Behavioral Health at 647-5440 or stop by for a visit, as depression left untreated can become a crisis situation.
Imagine 10 years of suffering, right? And that's why it becomes a crisis if this person is suicidal, right? Because 10 years is a long time to go with the stigma and people saying, you know, you can snap out of it. It can really create a sense of hopelessness, right, and worthlessness. So we really want to reach out to people, right, and we're here to help.
For more information on how you can fight depression for you or your loved ones, you can check out their website at gphwc.guam.gov.